Imagine that your partner has been diagnosed with depression. You may go through a bunch of feelings. Empathy because they're really suffering, some amount of guilt because you wonder, did I do something to cause this? You may really want to help. So you may talk to them, listen to them, soothe them, feed them, spend time with them. Then after some time, instead of getting better and feeling grateful, they may stay depressed and dissatisfied. At this point, it becomes more complex. You can feel anger that things are not working, anger with them. Why can't you just get with the program and get better? You can feel fear. Have I bitten off more than I can chew? Is this the way it's going to be? Have I signed up for being a caretaker for life? You can feel frustration or resentment that something that you hoped would be one way is turning out to be fairly different. And finding a way to sustain yourself and your relationship through these feelings which are likely to come is definitely something that's a bit of a challenge. A person with a mental illness, especially a neurotic, more emotion-based illness, is well capable of having a relationship, well capable of loving. In fact, because they have learned to tune into their own emotions and they're more sensitive to themselves, you might find that they're also able to tune into your emotions better and they can be more sensitive to you. So this can even be an advantage in some ways. But of course, it is not an unmitigated bed of roses and it does bring its own set of problems with it. As a client once said to me, I don't know if I'm ready to date someone with a mental illness because I don't know if I can handle it. And this is a genuine and honest question which you're very well allowed to ask yourself. Although I would recommend that you don't answer it just based on the diagnosis, but answer it based on the actual person who you're interacting with. Being with somebody with a mental illness, it can be more emotionally demanding. They might need more consistent care and more care, more intensive care as well. And it's something that it's important to figure out how you can give it to them. Here, it's useful if you can be present with them in what they're going through. Try not to judge them for being extremely scared and anxious and not being able to do things which other people can do, or for not being able to pull up their socks and get on with it and get on with life, because this is not something that's easy to do. At the same time, it is also okay for you to set some limits around what you can handle and what you can't handle here. We'll talk a little bit more about that later, but I just want to end with saying being present emotionally with the person doesn't necessarily mean you have to share their emotions. In fact, for a depressed individual, it can actually be nice to be with a non-depressed individual who can see a more positive side, who doesn't take everything very heavily or deeply. And so it's fine to be yourself, to be cheerful, to have your life and carry on and stuff like that. Well, yes, there is a genetic loading with many mental disorders. There is also the fact that the environment that the child grows up in will be slightly patchy. Okay. At the same time, I have seen enough mothers with various diagnoses to know that it definitely is not something which prevents you from being able to parent. I am saying mothers because this does tend to be a little bit more of a concern for mothers than it does for fathers, although it shouldn't be. It can affect the children, but it need not necessarily be a very bad impact, and ultimately it is more useful to look at the person again and what they can do or not do, rather than look at the diagnosis or the label that they have, because often that's fairly uninformative in terms of telling you how functional a person is. Two individuals with depression are not the same, and that's something that's very important to keep in mind. Largely talk to them, ask them, do I do anything that triggers you? Do I do anything which makes it worse for you? Do I do anything which suits you or makes it better for you? And use that feedback to decide what you want to do more of or less of. Remember that there may be some areas you can't go. There may be some things they have to do for themselves, and no matter how much you try to help or how good the relationship is, there may be some places that you're shut out from. This is okay. If you can be a little patient and give a little space to your partner to figure their own stuff out, this is something that's useful. When we have somebody with a mental illness in our life, we can be either overprotective about it or underprotective about it. So I've seen partnerships where, because one partner is depressed or anxious, the other partner just takes on all the life roles for them. So it's like, don't worry, you do this, you sit down, I'll make the money, I'll look after the house, I'll sort you out emotionally, I'll take care of everything. And this can actually come in the way of the ill person getting better, apart from putting a crazy burden on an individual. On the other hand, you can be underprotective. You can kind of say that, treat yourself like you're normal and then carry on with life. And this can leave your partner feeling abandoned or alone in dealing with whatever it is they have to deal with. And, I've had clients come and say sometimes that if my partner doesn't really care about me when I'm at my most vulnerable, then what's the point of being in the relationship? As with individuals, in couples and relationships as well, you can either make the disorder too central to your lives and around what everything else is organized, or too peripheral. So again, I'd suggest finding a middle ground. The last thing that I'd like to say is that, every individual has a right to a meaningful and fulfilling life, as meaningful and fulfilling as they can make it. This is definitely true for your partner with an illness, but equally it's true for you. It's okay to protect yourself. It's okay to make choices that work for you. I have seen partners feeling stuck in relationships where they are miserable and unhappy, but too guilty or too obligated to leave. And this is a situation, again, which in the long run tends to help neither too much. So if you need to look after yourself, please do.